Hey folks, it's Matt Zachary, and welcome to Vax On, a weekly segment of my podcast Out of Patience, right here on the OffScrip network.
Hey, I'm Alura Nanos. I'm a lawyer, a journalist, a mom of a teenage narcoleptic, and a professional big mouth.
Lou and I go back 30 years as best friends, and we're here to have fun and bring you a layperson's guide to what the hell just happened this week in healthcare as America gets its Vax on and shows COVID the door.
We're here together to learn, complain, and include you in the conversation.
So join us on Twitter at VaxOnPod and share your stories and grievances using the hashtag VaxOn.
All right, Matt, let's get at it.
Hey, here we are. We are not the people who just provided you with that delightful intro. We instead are friends of those people.
Yes.
We are business partners of those people. We are lifelong friends of those people.
That's true.
Respectively.
Yes. I'm not Alora.
Who are you?
I'm Stephanie.
Stephanie what?
Santoriello.
Oh my gosh, it's so good to have you here. I am Andrew McDowell, the co-founder and COO of OffScrip Health, good friend, very good friend of Matthew Zachary, who normally occupies this seat.
Yes.
We're going to do our very best to catch you up on everything that's happening, or at least many things that are happening relative to COVID-19, vaccines, and all of the shenanigans associated therewith.
Yes, exactly. Big shoes to fill.
Very big shoes.
Yeah, big seat.
Matt must be a size 14 or something.
Exactly.
I'm swimming in these things.
Oh, thanks for having me.
It is great to have you here.
Yes.
How are you doing? How has this week been for you? Has COVID touched your life?
No, not in a sickly way, but it has impacted my travels. So I went to travel to Salzburg with my mom and daughter. So in order to go to Europe, there's a lot that you need to make sure that like all your ducks are in a row. However, nobody cares. So, we all got our PCR tests. No one looked. I was like flailing this piece of paper, like, somebody please check this code.
My ducks are in a row. Look at them.
Look at all these ducks.
They're trotting across the street.
Exactly. They're swimming. There's bread coming. Nothing. Nobody cared. Then in order to come back to the States, you need to make sure that you are COVID negative.
Yes.
You need to get like a virtual test. So we did all of that, so that kind of like ends the trip.
Yeah, just these
on
dull, lame, biological, bureaucratic thuds.
Yeah. Well, I get it, except that we traveled through England, which doesn't have any restrictions anymore.
The living with COVID
yes,
program.
Exactly, which we shall touch on in a bit.
Yes.
But, so the whole point of being negative in Salzburg, but then I was on trams and the like, traveling in Heathrow. And then, so, so there's that. What else? I don't know. Just interesting nonsense in the COVID world.
It's true. It's true.
How about you?
Yeah, I mean, it is temporarily anyway, and for a period of time that is setting a world record for our family anyway. It's settling into the background a bit.
Mm-hmm. Good.
However, my wife has a very irritating head cold, and that is something that we didn't experience during the pandemic. And it's, of course, because the masks have come off in most locales, and locations. And so that's kind of an unwelcome return.
I know.
That wasn't something I was in love with.
Yeah.
And, I assume that I'll be getting this charming illness myself
so glad
soon.
we're sharing the room.
Yes. But we have, however, well, I'm being very careful not to breathe with too much
Gusto.
Yeah. This is some gustoless breathing I'm doing out of concern for you, Stephanie.
Well, thanks. I appreciate that.
You're welcome. And so basically we've tested to make sure that this cold is not COVID. It is not COVID. And I guess we'll see what happens next.
Yeah. Well, I guess nothing. Hopefully will be nothing. If it's negative, then it's negative. Negative stays negative.
Yeah.
Right?
Yeah. That being said, I mean, COVID keeps on innovating, doesn't it?
It certainly does. It's a great morpher.
The great morpher. It keeps on diving into all of those deluded, unvaccinated bodies, and it innovates. It mutates. It creates new versions of itself.
Right. Very clever.
It's bound and determined.
It certainly is.
To get this right.
Yeah. It's got a lot of letters left.
Yeah. And it's fortunate to have so many people out there willing to serve up their bodies as the nurseries for its creativity.
Oh, they're so thoughtful.
They really are.
Generous souls.
It's true. It's true. So where are we? I understand you have the goods when it comes to the headlines, the COVID-19 headlines.
Yes, I'm newsworthy.
Yes, you showed up.
I certainly did with
some facts
and a stapler and a pen. I've got it all.
You're ready for your first day of school.
Look at me. So the first segment we get to talk about is a generous man in Germany who got almost 90 COVID shots. And he sold.
Hold on.
Yeah.
This man got almost 90 COVID shots.
Right.
That's 30 times more than I've gotten.
That's a lot of pricks.
Yeah.
And sticks.
Yeah. Holy cow.
Yeah. He's like Swiss cheese now.
Okay. So I heard that correctly.
Yes, you are correct. So the reason he did that was so that he can sell forged vaccination cards and with real vaccine batch numbers. So he didn't want to be too false. So he got the real deal cards, except the fake deal person. Yes. So he made this his job. And, there's like 87 people out there with these, I could thank him for their, forged cards.
So a German man got 90 COVID shots in order to cash in on selling vaccination cards to people who had not been vaccinated.
That's correct. So people in Germany who are hoping to use their vaccine card to enjoy public life and go to places and theaters and stores, they can do that now thanks to Swiss cheese German man.
Swiss cheese German man.
Yes, with all of his vaccination holes. So, I mean, this is insane that he got away with it for that long. Nobody noticed until he happened to come back-to-back days to the same location, and someone was like, "This guy's familiar."
Yeah, he lost track of where he was going. He got lazy. He let down his guard.
Yeah, or maybe he was glowing, or his third armpit from his 90 vaccines was a giveaway. There's got to be something. He's got to look.
His third armpit.
Yeah.
So getting 90 COVID shots. Health warning from Stephanie.
Exactly. It's
can
very
give
medical.
You a third armpit.
It could. You don't want to be. You got to be careful.
You do. It's true. It's true. So, I guess there's an observation here. This person, having been arrested, is, I'm guessing, based on the fact that he was arrested, still alive.
Yes.
Probably
that's a good
healthy?
Observation. I guess so. Maybe he's uber healthy.
I assume that in this news story, it's not mentioned whether or not he is feeling ill.
Yeah, I guess he's okay.
Swiss cheese third armpit German man has kept the German authorities busy tracking down all the fake COVID-19 passports he's been handing out. But, I suppose that one question you could ask is, does person number 90, does the person receiving vaccination pass number 90 not pause and think to themselves, maybe I should just get the shot?
Yeah.
I mean, this guy has gotten the shot 90 times.
And he's pretty much
and
okay.
He was able to hand this thing to me.
That's right.
And cash the check or whatever means of transferring funds was. So, it's
I'm
just...
thinking cash, probably.
Yeah, the evidence, it's probably cash. But,
you never
the guy
know.
did show up at the same place 2 days in a row,
true,
so maybe he's not too sharp.
Yeah.
Or maybe he's got COVID brain.
Maybe.
Well, this man in Germany, I would like to know more about him. I'd like to know how healthy he is.
Yes, me too.
I'd like to know if he's being studied.
Yeah. I mean, at least let's make some use out of this.
Yes, I'll say he's super boosted. I mean, the word boost doesn't even apply anymore.
I know.
This guy's jacked.
He's like when you have those sneakers that have springs in them. This is this guy.
Yeah,
he's like self-propelled. Just really goes fast down the street.
He really goes fast down the street.
That's why he did it.
So he's a very fast man.
Yes.
Who is Swiss cheese.
Right.
And he's got a third armpit. My God.
Yeah.
So how are things set up in Germany right now? I mean, why do people want these passports so badly?
Well, just so that they can, have access to public life and venues like restaurants and swimming pools and workplaces and, all the places that you want to go in public. And so, I don't know.
My goodness.
Yeah.
Well, these measures are pretty strict. Do we have any indication of how well they're working in Germany?
Well, Germany has seen high infection numbers for weeks, it says, but the restrictions are being lifted. So masks aren't required. They're not required in grocery stores and most theaters, but it's still mandatory on public transportation. So,
How are the numbers looking? Are they going up? Are they going down?
It said here that the agency reported 74,000 new COVID infections in one day, while less than a week ago it reported 111,000 daily infections. Overall, Germany has registered 130,000 COVID-19 deaths.
And that's so 130,000 deaths.
Yeah.
I mean,
You're getting angry.
I mean, we're accustomed to laughing about how strange this new reality is. And now we're sort of leaving it behind us because we are absolutely exhausted with it.
Yeah.
And we can perhaps be forgiven for that. But
still.
that's 130,000
I know.
people who died in Germany.
Yeah.
In a couple of years.
Yeah. It's really sad.
It truly is. And there are people who are trying to get around the system
But,
that's
yeah,
designed to prevent that.
Right, exactly. Like, what are you denying? You're not, right?
Yeah.
Well, listen.
Oh my God.
I know. It's nuts. It's
Well, the
nuts.
whole show is about COVID-19, so I suppose there's no escaping it. What's up? What's up now? What's next,
next,
Stephanie? What do you have in your bag of joy?
Exactly. That's what I come. It's a satchel. Oh, boy. So this is interesting because, like I said, I just traveled to Europe. And although England was not my destination, I did had a layover flight, which was a disaster, in Heathrow. And, if you want to limit your exposure to people without masks, don't have a connecting flight in Heathrow, maybe. But, hindsight.
Noted.
So, we landed, we're in Terminal B, then it's the board says go to Terminal A, then Terminal C. We literally were all over. I should have clocked my Fitbit or whatever, my pedometer. But, that's a lot of different trams, a lot of different escalators and elevators. We were all over the place. And so no masks anymore there, even on the public transportation, within the airport. So, yeah. In the UK, COVID's on the rise. Shocker.
Yes.
Yeah, this is the doi moment of this is the second segment doi moment.
Yes.
So basically, COVID-19 in the UK has reached record levels. It's with about 1 in 13 people estimated to be infected with the virus in the past week alone. So that's a lot of people, 1 in 13. This latest surge is Omicron variant BA2. And that's the dominant variant across the UK. Of course, this is coming off the heels of Boris Johnson's great living with COVID plan. And more people are going to be living with COVID. So, yeah, that's where we're standing right now with the UK.
My goodness.
Yeah.
I think I always go back to hospitalization levels, right?
Right.
There's another line that you cross when it begins to become clear that you're about to run out of emergency beds.
Right.
To me, that's kind of the statistic that really should guide our decision about whether or not we're going to shut things down, especially now that we have a vaccine.
Yeah, of
right?
course.
As well as other measures that can be taken after you do catch it. Right. And so I'd be very curious to know about how things are looking in the UK when it comes to the availability of hospital beds. That might be something that we need to look up.
Oh, that would be something good to find out. It says, hospitalizations and death rates are rising again.
Right.
Although the number of people dying is still relatively low compared with earlier. It's still, the more and more people contracting it.
The way that I think about this, and I'm certainly welcome to input. I'd love to hear from our listeners about whether or not you think this is wrong-headed.
Yeah.
But I don't think that we should stop thinking about this after hearing what the infection rate is, what the positive test result rate is. We should also know a little bit more about the impact of the variant. Is it in fact threatening to overstuff our hospitals and make them unusable to people who need them for other purposes as well?
Of course.
My sense is that hospital-oriented stat is a great master stat for us to be following.
Right.
When it comes to deciding whether or not we need to shut down society again.
Yeah. But I mean, if it's something so simple as wearing a mask on public transportation, like, why wouldn't we? Oh, sure. That just seemed so loosey-goosey after, like, the rules to travel were so, like, so many emails I got from British Airways and Lufthansa because we took different airlines. And it was like, I was worried that we were going to get stopped somewhere, that I didn't have the right paperwork or the right app uploaded and downloaded. And, it was like really crazy. But then to go to England and it really nothing mattered. Well, now look at the stats, right?
Exactly.
It's obviously that it matters. Those things in place were in place for a reason, and now let's see. This James Naismith, the biology professor at the University of Oxford, said he believed that except for those who are completely shielded or not susceptible to the virus, most people in the country would likely be infected by the BA.2 variant by the summer. This is literally living with the virus by being infected with it. So, like, we're not seeing the number of deaths, but still, do we want it?
Yeah, I mean, I don't want it in my body. I want to go seeking it out.
Well, the other thing I wanted to mention about these Omicron variants is that there is now under the Omicron umbrella is another variant, which is called this XE.
Wasn't there a version of Windows named Windows XE?
I think
it's starting
maybe.
to sound like operating systems.
Yeah, exactly. Yeah. So, this is as of March 22nd. It's a combination of the BA1 and the BA2. Those are both Omicron strains, and now they've made an Omicron baby. We named it XE. It's like Elon Musk. Oh, gosh. So I'm not looking forward to hearing more about this other very contagious, strain.
Right. Well, if we're going to jam up our hospitals again, if it's looking like we're heading in that direction, then I will mask up again, and I will start hiding from other people again.
Yeah.
Because at that point, it's no longer about me.
Right. I like the security of the mask. Like when I was traveling, I mean, sometimes I'm wearing it outside by mistake because I'm still I forgot that I had it on. But I especially traveling with my mom and my daughter, and we're on the bus that's traveling from the gate to the plane. Everybody's all naked faced. I don't like it.
I don't either.
I don't like your naked face.
I don't like your naked face. And with that, we're going to do some ads.
All right.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
And we're back
That's great.
with our naked faces on full display. What else is going on? What else do you have in your bag of joy?
My bag of joy contains a sermo poll.
Oh, let's
It's time
have
for the sermo poll.
us a moment.
Oh, yeah.
We have this fantastic partnership with an amazing organization called CERMO, which is a social network for doctors where doctors all over the world exchange information about diagnoses. They share information about their lifestyles and what it's like to be a doctor. And they also answer these polls for us on a weekly basis. Doctors all over the world
That's amazing.
take our questions and they answer them. So what did we ask them this week?
So fantastic. So today we asked them about, this week we asked them about the BA2 Omicron subvariant. It's behind, of course, like we just said, the current surge in Europe. The World Health Organization just announced that BA2 is now the dominant strain around the world. It is more contagious than BA1, the original Omicron variant. But health officials believe that thousands of people who have been infected by BA1 will have some level of immunity due to the similarities between the two strains. So we ask, ready?
I'm ready.
Are you excited?
This is doctors all over the world answering this question.
Yes.
Intriguing. Okay.
Yeah, it's amazing service. So the first question is, do you have patients infected with the BA2 variant? What do you think?
Doctors all over the world, not just in Europe.
Right.
I'm going to guess that it is more heavily weighted toward yes than I'd like, but still not a majority.
You are correct. Gold star on question number 1. So it's 45% yes, they have patients infected with BA2, and 55% no. And that equals 100. So that's that.
Rock solid in statistics.
Yeah,
That's you.
That's I'm known for my math.
That's why they call you Stephanie Statistics.
Yes, no one has ever said that.
It's on the record.
Oh, now that you said it, maybe it's right. Maybe it's true. So our next question was, are the patients who are infected with the BA2 variant of COVID-19 showing more severe symptoms or more mild symptoms? What say you and the doctors around the world?
More severe symptoms or more mild symptoms? I'm going to guess mild symptoms.
You are correct by 1% margin. So 11% are having more severe symptoms, so that stinks. 40% are having more mild symptoms, so that's encouraging. 39% are having the same symptoms, and then 10% are asymptomatic. So those lucky ducks out there that are spreading unknowingly.
Delightful.
Yeah. Our next question in the poll is, in your professional opinion, are the current vaccines effective against the BA2 variant? What say you?
There is almost always roughly a third of any population that earns my utter condemnation.
Mm-hmm.
So I'm going to guess that roughly a third of doctors, just like any other population, fail to answer this question in the affirmative.
That's so interesting because I would have just assumed that they would all. Yeah, why would I assume that?
It's a population.
You know what they say about making an assumption. So you are correct. 71% yes, vaccines are effective against BA2, and 29% say no.
Wow. Yeah,
you're really good at this.
Yes, I would. I'm still waiting to be wrong about that.
Yeah.
Yeah. What are we going to do about this?
I don't know. That's I don't know. I'm not sure.
Go back in time and do a better job of educating them.
Yeah,
I suppose.
I guess. Good luck with that in your time machine.
I'm working on it.
All right.
When I'm not recording podcasts, I'm working on a time machine for this very purpose.
Yes.
I'll give you an update next week.
Gonna go back in time. Do you remember that?
Oh, of course I do.
It's an SNL reference from.
Oh, I see.
Gonna go back in. I don't know.
Yes,
I say it a lot.
There was a character who just would not stop singing that song.
Yes, it was. I think it was Kevin Nealon. I'm gonna say.
That sounds good.
Yeah, I'm gonna say it was him. All right. So next is, do you believe that reducing COVID restrictions is a good idea right now? What do you think they said? Around the world.
Around the world. Well, that's kind of a weird question to ask such a large pool of people.
Yes.
Because the answer has to vary from place to place.
You're right, it does.
So guessing, once again, from across the world, I suppose that the answer would be no?
No, that reducing COVID restrictions.
Is it a good idea? I think the answer would probably be no.
Okay. So 59% said yes.
Oh.
And 41% said no.
Okay.
So isn't that interesting?
It's relatively interesting.
Yeah.
This is where, of course, I want to figure out what the geographic distribution of the respondents was.
Right. Well, we could do that next. We'll get the map and pins.
We'll do that.
And the thread and like Homeland. We can make like a whole bulletin board.
We'll do that.
Okay.
I'm down with that.
Right after.
I'm clearing my calendar.
All right. Sounds good. I'll get the yarn. So now this is a very interesting follow-up question. Do you expect that BA2 will lead to another surge of COVID in your area or region?
Who's going to say no to that? I mean, maybe somebody who's not sure what the word surge means.
Right.
But of course, there's going to be an increased, right?
Yeah.
That'll be the answer.
Of course. 76% said yes, and then your 24% said no.
Our friends over there.
Right. So, it's interesting that a majority of doctors want restrictions lifted, but yet they know it's going to cause another surge.
Yeah.
So,
There's
I mean,
got to
that
be
doesn't
some respondents who feel both ways, I suppose.
That's very...
Although, we're talking about a surge in positive test results, but if the hospitals don't fill up,
right.
if people aren't getting seriously ill,
that's true.
Then I think that could account for those two answers.
Right. Yeah, then you could be okay with it both ways.
I think so.
All right. I mean, I guess.
Yeah, I mean,
if
it is indeed just the flu.
Right.
If we get to the point where it is actually just the flu,
right,
then I suppose we can treat it
right
like the flu.
Right. You're right.
Thank you.
You're right. And the Sermo poll is right.
Thank you, Sermo, for that Sermoment.
Yes.
For that picture, that window into the thinking of doctors across the world.
Yeah, it's really great that you get to ask those questions.
It is a privilege.
Yeah. Okay, so now this third segment, are you ready for this? You don't know if you're ready.
I don't know what it is yet.
I know.
But I feel ready.
Oh, well, I went to a Broadway show this week for the first time and I love going to theater.
What did you see?
6.
Oh, cool.
Yeah.
Yeah, we want to bring our daughter in particular.
Yes.
Yeah.
She'll definitely enjoy it. And it's the perfect 75-minute show with no intermission.
Oh.
Which I like in general because I get sometimes a little, Jimmy legs. I got to stretch and stuff. And here, there's no need because by the time you need to stretch, the whole thing's over.
Spectacular.
Yeah. And there was, nice checking of vaccines required, of course, before entering, and you get a stamp and blah, blah, blah. And then we all wore our masks inside.
Peace of mind.
Yes, which is great because you're really on top of everybody.
Yes.
It's like super, super tight.
Yes.
Yes. But, nice that Broadway is back, except for poor Macbeth.
Oh.
Yeah. Macbeth is
the Scottish play.
Yes, exactly.
Maybe the problem is that somebody said Macbeth.
That's what I said.
Oh my God. I'll bet no one else has said that.
I bet we're the only ones that know about that superstition. So, so basically Daniel Craig, who is playing the Scottish king. So he is...
That's cool.
Yeah, well, it's cool if he gets to do it.
Yes, it is.
And they're running out of time because they need to have opening night happen in a certain time so that so it could be eligible for the Tonys.
Oh, goodness.
Yes, so he's got to get healthy right away.
Oh, man.
Yeah, and stop spreading his COVID. So basically, Daniel Craig, who is starring in the title role of Macbeth, tested positive. And so the production was canceled through April 8th. So that's...
Clock is ticking.
Yes. So pretty soon, hopefully they'll get to open up again. But, coronavirus cases are rising here as well.
Here in New York.
Yes, here in New York. And so several Broadway performers have tested positive. And the problem in this show is that it's so new, the understudies are not ready yet. So they can't, you have to cancel if you can't have somebody fill in your spot.
My goodness.
Yeah. So yeah, but this, I'm a superstitious person anyway. And so, this whole slap, the Chris Rock slap, he congratulated Denzel on his Macbeth performance right before his unfortunate slappage.
Oh.
Yeah. So basically, this is really a big thing. I'm glad we're not in a theater right now because I'd be crossing my fingers and whatnot, throwing water and whatever. I don't know.
Maybe this will help.
Yeah.
Stephanie, break a leg.
Thank you.
Does that help?
Yeah, I think so.
Yeah,
Maybe.
I think I fixed it.
Yeah. Thank you for that. Yeah. So that's wasn't that a weird coincidence?
I'll say.
Yeah.
Oh my goodness.
I know. Just say the Scottish play. Everybody will know. And then you're safe.
Then you're safe.
This would be a good time machine moment.
It's just like masking.
It's exactly. So you're going to build your time machine. We're going to go back in time. And Chris Rock will say Scottish play.
Yeah. One thing, there's one thing that's really complicated and hard, and that is to properly educate a third of humanity.
Right.
But then all we have to do after that is we have to encourage Chris Rock to say the Scottish play instead of Macbeth.
Exactly. Oh my goodness. So, all the Broadway workers and actors, everybody in the Broadway theater is required to be fully vaccinated. But as we know, that doesn't mean you can't catch it. So that's the situation over there.
It's a nail biter. I'm on the edge of my seat.
I know what's going to happen.
This coming Friday, tomorrow, for all of you listening to this episode right now, tomorrow we will know whether or not the Scottish play was able to reopen on Broadway.
I know.
Will they slip an understudy in?
I don't
One
know.
who was supposedly unprepared.
Right. And has since really studied.
All eyes on Broadway.
Right.
If the show is not able to open, I think that I speak for the rest of OffScrip Health when I say that the comparatively safe format of remotely produced podcasts is available to you. Yes. We welcome you to OffScrip Health to perform the play
Daniel,
known as the Scottish play.
Right. Ruth and Daniel, come on over. Lady Macbeth, just,
we're here for you.
We are. It's very cozy here.
Best of luck, Daniel.
I know. I hope everybody gets well soon and they can have their performances. And
he's one of our most vocal listeners.
Is he?
He's always praising Vax On in the press.
Yes.
His Benoit Blanc voice.
Oh yes, I've heard.
Have you seen Knives Out?
Oh no, I don't think I've seen that.
Well, now you have to.
Oh,
You've got to see it tonight.
All right.
That movie is wonderful.
Yes. Oh, I look forward to it.
Benoit Blanc.
Oh.
He actually has this accent
Oh, really?
in the movie. It's quite unsettling and unexpected.
Is that
He plays the private detective Benoit Blanc.
from New Orleans?
Yes.
Well, listen, he's a good actor. It's not easy to do those accents.
I think perhaps I shall end this podcast by speaking like Benoit Blanc.
I'm so sad
It
that
has been a pleasure doing this podcast with you, Stephanie.
It certainly has. I've thoroughly enjoyed myself. Now I need a beignet.
That's all for now. If you like Vax On, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. Tell us your shit show of a healthcare story by leaving a message for us at 855-AUDIO-66, and we might just use it in a future show. Vax On is a product of OffScrip Health. We are a healthcare engagement company built for patients and caregivers by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our senior producer is Brianna Seeley. Our hosts are Matthew Zachary and Allura Nanos. It is recorded, mixed, and edited by Brianna Seeley. For advertising and media inquiries, email media@offscrip.com. That's media@offscrip.com. For more information, visit offscrip.com.